This is We Need to Talk with Dr. Darcy Sterling, where I give you the tools and skills you need to love better so you can live better. A listener recently wrote in and asked, how do I know if I need therapy? How do I know if therapy is worth the money or if I'm just a regular person living with regular person problems that I can muddle through on my own? That is one of the most common questions people have about therapy. How do you know if you need it? Before I dive into an answer, let me just say that I think examining ourselves through the process of therapy is something everyone should do, if for no other reason than because it'll benefit the people we're closest to. There's a ripple effect that we have on our circle, on our tribe. And when we know ourselves, when we know our wounds and our emotional soft spots, we are a lot easier to be in relationship with. And the opposite of that is also true. When we're unaware of ourselves, we can't possibly understand the impact that we're having on those closest to us. We're more likely to blame others for problems when they arise, and we're less able to help resolve things during disagreements. Basically, I think going to therapy is a public service, and I think everyone should do it. That said, I'm going to get more into the actual question, help you distinguish between everyday stress and signs of a more significant issue, and I'll give you my opinion of the best types of therapy for various issues that you or a loved one might be dealing with. So whether you're considering therapy for the first time, or if you're wondering if now is the right time to cycle back in, I'm going to give you everything you need to make an informed decision about your mental health. Here to help me with this conversation is my niece and co-host, Ashton Tardif.
What are some reasons why people might avoid therapy?
So even though you and I come from a family where there is very little stigma around seeking therapy or talking about mental health issues, as a society at large, we still struggle with that stigma. And the cultures that we come from can increase that stigma. There are lots of cultures that really align with the belief that keeping personal problems private is a sign of strength. The cost, of course, is a huge hurdle for people. And then finding a therapist. People don't necessarily know how to find a therapist. They don't know where to begin. It can be a complicated process. Thinking just about my own reasons why I might not seek therapy. Well, I've had negative experiences as a client or a patient of therapy. And when you've had a negative therapeutic experience, there's a hesitation to go back into it because hope has been diminished a bit.
It's like dating. You have like a really bad experience and you're like, do I really want to do this again?
100%. Yeah. I mean, who wants to go back into an experience that was significantly disappointing to them? And then some people have an unwillingness to really reflect on themselves. I like to say that people tend to come into therapy for one of two reasons, either to take responsibility for why their life looks the way it is, or to blame other people or circumstances for why their life looks the way it does. There's another cohort of people who don't want to examine it. And to be clear, that first cohort is the one that I welcome, not the second, and certainly not the third. There's something to be said about having to be ready for therapy. Even Freud could not come down and squeeze his juices on somebody who was not open.
Right. I mean, you can only be met where you're ready to be met. It's like a colossal waste of money and time if you are in therapy and don't want to be in therapy, and being forced to be in therapy too, like the ultimatum, like especially in relationships, we can't do this unless you get therapy. I mean, at the end of the day, I don't think that that's quite conducive to finding a solution.
That's actually not true. I just want to demystify that. Steph, your aunt, my wife, who is a couples therapist, will tell you there is always a pusher and a pushy. Somebody who pushed couples counseling and someone who went in a bit less enthusiastic about the whole process. Right, but it doesn't make it invalid, and it doesn't mean that those people cannot be helped. However, in individual therapy, it is really important to meet people where they're at and to make sure that people are in a place where they're open to it. As certainly if you're going to go to somebody like me. I think that my whole branding just repels people who are not willing to look at themselves. And I'm totally fine with that because early on in our careers as therapists, we wind up seeing lots of people who are not good fits for us. I know what my good fit is, and it is not trying to persuade someone or motivate someone to be open to change. I am good for the person who is ready for it. There are other people who are better at persuading and motivating. That is not my jam at all. It's not my strength.
I mean, I kind of feel that way about a lot of things in my life. Anyways, I digress. As someone who has been in therapy on and off from a very young age, something that I've struggled with is having to decide, everyone has sad days, everyone has bad days and anxious days. So how do we know when a mood is likely to pass or if it's a sign that we A, need to start therapy or B, get back into therapy?
Ideally, you are an expert in your mood tendencies, meaning you know that you yourself are prone to sad days or anxious days if you are prone to that.
Indeed.
or cranky days if you're somebody who is check and check.
Yeah,
or
I'm
cranky
going.
days. So in a perfect world, we know what our mood tendencies are. How frequently do we struggle with negative feelings and negative thoughts? And then how intense do those feelings and thoughts tend to be? When the frequency increases, meaning maybe you usually cry 5, 6 times a year, 10 times a year, and now you're doing it that often in a week or a month, that is something to pay attention to. And then how intense the triggers are that cause you to cry or to feel the way, shift your mood in that negative way. So whatever, everybody's got their own tendencies towards negative thoughts and feelings and moods. Not everybody is prone to anxiety or depression or crankiness or irritability, but we all have some tendency towards some of those things. We need to know and be tracking, well, how intense is the external event, whether it's a person, a place, or a thing? How intense is that external trigger, generally speaking, when we start to feel triggered into either feeling intensely sad or tearful or anxious? So you want to be monitoring, well, gee, normally I would not be choking back tears during like an Instagram post or something. But here I am looking at this beautiful cat up for adoption and I find myself choking back tears. And if that's the case and that's not your norm, then that's something to pay attention to. And the same thing goes for anxiety, or whatever negative feeling that you're questioning. It's all about frequency and intensity. I'll say this, it is much easier for therapists to intervene when you're not in a full-on crisis. You don't have to wait until you're bleeding out to see a therapist. And I would say that if you're questioning it, I would suggest scheduling a consultation with a licensed therapist. But again, I prefer prevention over emergency interventions.
What if you can't identify your trigger or there isn't an event? You're just feeling generally like more anxious or just general unhappiness. Is that something that would be due cause to revisit therapy?
Yes, especially if there's not a trigger. So that's a great question. Thanks for asking me to clarify that. So especially if there's not a trigger, if there's nothing causing it, that's a big, I don't want to say red flag, or it's a big indication that something needs to be looked at, that you're going through something. So especially if there's nothing triggering you and you can't identify an external reason for why you're feeling the sudden way that you're feeling, then for sure, that's a moment that you want to contemplate therapy.
It's when you call in the third party. We can't do it all. Speaking of third parties, if you come from a family where one or multiple people have needed therapy, and I say needed does not mean they necessarily have gone into therapy, because Lord knows everyone who needs therapy doesn't seek it, hence part of the ethos of this podcast. Is that a sign that you're likely to need therapy as well? And to make that a bit more granular or understandable for people, is it like something you can inherit?
If you come from a family where one or more people have been in therapy, it could mean a couple of things. First and foremost, it could mean that you actually come from emotionally intelligent people and a family that fosters a culture of exploring emotional issues and growing emotionally. It could also mean that there's a genetic predisposition in your family to some mental health issue like depression, anxiety, or ADHD.
Mhm.
Now, you may have a genetic predisposition for something, but it doesn't mean that you're doomed to get it. We know that environment plays a huge role in triggering our predispositions. So in our family, using one of the most mild diagnoses that many of us meet criteria for, ADHD runs rampant in our family. So if you have kids and you're aware that ADHD runs in the family and you've got your shit together, I realize that's a lot of ifs. And what I mean by you've got your shit together, it means that your own ADHD is well managed through behavioral changes. Like you keep your environment free of clutter, you're well organized, you know how to use your time effectively, you've employed calendar, timers, alarms, notifications.
But without the help of medication?
No, we're not even in medication yet. So if you've got your own symptoms managed environmentally, I'm not talking about medications here. I'm talking about you've created behavioral modifications to compensate for the ADHD. You can then raise your kids in an environment that is relatively peaceful, where they know what to expect, which is ideal. You always want kids to be able to predict the consequences of their environment. That is how consistent you want your parenting to be. It's an ideal, it's an aspiration. Nobody is that way, but that's the goal. We want our environment to be so predictable that the kids know if they've done something that normally triggers a negative consequence, they're going to receive that negative consequence before it even happens.
Mm-hmm.
But if you have an environment that is well managed, using ADHD as the example, you wind up teaching your kids through the life that they're living that this is how to live your life. And even if they have a predisposition for ADHD, there's a good chance that they're not going to become symptomatic. There's a chance that they're not going to become symptomatic because they're raised in an environment that is not visually chaotic. However, if you're somebody who has ADHD and you pop a Ritalin 3 times a day, hoping that that's going to allow you to get through your day, and maybe it does allow you to get through your day, but your life looks like a disaster, and you've got kids growing up in a very chaotic household where there's not behavioral modifications in place, you're forgetting, to pick them up, to drop them off, stop. I know that everybody's got examples of that. You're not going to throw my sister under the bus on this one, or my ex-brother-in-law. So if you have an environment that is well managed, you can potentially bypass the potential for your kid to have ADHD symptoms if all you're doing is medicating yourself and you've not compensated environmentally. There is a really good chance that if your kids have a predisposition for ADHD, genetically, they're going to get it. All of which is to say, we know that environment is much more important than genetic predispositions. So if you're somebody who struggles with depression, but not only have you been in your own therapy, but through your own therapy, you've learned what to do when you have sad days so they don't turn into depressive episodes. You're somebody who knows how to disconnect from technology, you journal, you engage in mindful exercises, you talk to people in your life that you're close to, you have a close social support network, there's a very good chance that your depression is not going to be incapacitating in the future. And then if you raise kids in that environment, kids are learning from what we do more than their genetics and more than what we tell them. So what we're modeling for them, the environment that they're living in, is a much stronger indication of what they will and won't struggle with.
Leading by example, you're saying, is key.
Correct. And if all you're doing is medicating yourself, so ADHD is a really good example of this point. It's 40% medication, 60% behavioral modification. If you can fix something 40% with a pill, that's where 99% of people stop. That's a huge improvement. Psychotropics are notoriously ineffective. They're not very effective at all, except our stimulants. They're almost universally effective with ADHD. And so if all you're doing is popping a pill and through that medication, you're able to white knuckle your way through life, most people are going to stop there and they're not going to create the behavioral modifications that would really give them the next 60% bump in their level of executive functioning. So I don't blame people for not doing it, because I, at my core, am a very lazy person. The medication wasn't enough for me. It wasn't enough for me. I needed hardcore behavioral modification in order to really have a well-tooled lifestyle.
Well, and it also, and I know we'll talk about this a bit later, but I also, just speaking from personal experience as well, is that while, the pill may work for you for a period of time, it doesn't mean that it's going to yield the results forever. And I was actually going to rebuttal you earlier about it being more about behavioral modifications, but, as someone who is on medication, it's true, your environment is one of the biggest factors, but I feel like it's a much more complex thing based on the person, but we'll get to that later.
But Ashton, you're somebody who has totally incorporated behavioral modification that I have never taught you. In fact, I'd argue you have taught me, certainly when it comes to time management, you have taught me enormously, how to regulate certain things in my life that nobody ever broke down for me. You're like, I'm sorry, I have to go to bed in about 20 minutes. And I'm like, you said you wanted to be asleep in an hour and a half. And you were like, yeah, well, first I have to take my makeup off. And then you started going through the whole process. And I was like, oh, that does land at the hour that you want to be asleep. So you don't just get up to go to bed at that moment. That is the moment you have finished your nighttime ritual. So not to disclose.
No, I don't care. Of course. But it's just funny because that sense of stability from the outside, that planning, actually stems from a place of anxiety and needing control, which, we don't need to go into because this is not a personal therapy session for me, because I could really tell you guys where that stems from, but I won't. Let's pivot away from specific mental illness. Can physical illness mean that you might need therapy?
Yes. Yes, it absolutely can. And this may be surprising to people. So sometimes people experience what we call somatic symptoms. Those are physical symptoms that have no medical explanation, and they're physical manifestations of emotional distress that don't on the face appear as if they would be emotionally rooted, but because somebody has gone to a series of doctors and has had lots of testing, and the tests have ruled out any medical explanation for something, it is often the second tier to make the presumption that whatever the person is struggling with is emotionally related. So things like chronic pain, like headaches, backaches, chronic fatigue, GI issues like stomach aches, or GI issues like diarrhea, sleep disturbances, trouble falling asleep, trouble staying asleep, straight up insomnia, night terrors, night sweats. We always want to rule out medical causes first, but let me just go through the list further. So difficulty catching your breath, racing heartbeat, changes in your appetite up or down. All of these, again, they require medical exams to confirm that there's no underlying medical condition. But once that's been confirmed, we often consider those issues to be psychosomatic. Now, I want to be very clear here. Psychosomatic does not mean that they're made up or the person is crazy. It means that the symptoms, which are real, are caused by and arguably can be treated with mental health care. But the root of them is an emotional root.
So is that a mind-body connection, basically, like manifesting?
Particularly in individuals who grew up in a family or culture that is not down for therapy, doesn't talk much about their feelings, really prides themselves on pulling themselves up by their bootstrap and just like chugging along and powering through life. Our bodies will indicate when that's not working anymore. And some of those physical signs can be eliminated by going into your own therapy if, in fact, there's no medical reason for it.
Wow. It's honestly really powerful to think about. Sometimes
mean,
our
if you
body rejects things before we realize it. I mean, quick segue, when I was going through my horrific episode 1 experience where I was going through a horrible thing with my boyfriend, betrayal, was waking up with night sweats and itches,
You
like
were?
crazy itches and there was no marks on me, no bug bites, nothing. Like I was so itchy all of the time.
Ooh.
And the minute that everything came to light, it stopped.
You mean
So
before you
found out.
discovered that he had been betraying
Yep.
you?
And it was like towards the crux, like it was right, like the months leading up to finding out, but like the weeks right before I found out, it was almost unbearable. I was like, I'm allergic to something. And I was
Wow.
allergic to infidelity, turns out, and the relationship. Speaking about life events, do you think that people should automatically go to therapy when they have a traumatic life event happen? Like me, for example. But it could also be something like your parents getting divorced, losing a loved one, even losing like a friend or a pet.
Yes. Yes, major life events can indicate an off-ramp right onto therapy. Yes.
But automatically?
Well, it depends. And it kind of makes me think of that scene from Sex and the City where Carrie and Big break up and she is leaning
Which time?
She is leaning a little too much on her friends and they call her out.
All right, who's gonna tell her?
What? Honey, you're obsessed with talking about Big, and frankly, we can't take it anymore.
It's out of our league.
What is this, an intervention?
Yes, stop her before she obsesses again.
Isn't part of the whole breaking up process that you get free reign to whine to your friends?
Of course you do. But maybe you should think about whining to a shrink.
Why should I pay someone when we can talk for free and then go get a drink or whatever? I don't need professional help. I've got you guys.
For about another 10 minutes.
And then we're cutting you off.
Were my friends right? Had I crossed the line from pleasantly neurotic into annoyingly troubled?
Things I ask myself probably once a week.
So yeah, I think it is important to recognize that there is a tipping point of how much we can lean on our friends before we unintentionally provoke them to perform a role that they are not qualified for and probably shouldn't be in.
Yeah.
You are still going to need your friends, even with a shrink. And talking to your therapist should not feel like a duplication of that service. It shouldn't feel like talking to a friend, unless I'm your friend.
Yeah.
I'm kidding. But I'm kind of not kidding. But that's for another
A different type of
conversation.
friend.
A different, like your
Special
normal
friend.
friends, your normal friend should not feel like your therapist. Moreover, if your friends are not therapists, your therapist should not feel like your friends, because that indicates, to me, that's a red flag. It should not feel like a coffee date. Are there times when therapy is friendly? Yes. And I remind myself in those sessions, you know what? It's okay for us to just talk about your feelings and not look at the spreadsheets and the charts that I give you like a neurotic, crazy person. We can just talk about how this makes you feel. But by and large, I want to believe that my therapy sessions do not feel at all like a coffee date a woman would have with her closest friends.
Yeah.
The actual point to this is, I think it is reasonable to hit therapy if you have had a major life event like a breakup, a death, or a major life transition, like you move or you change a job. By the way, the most stressful life events are in this order: death of a loved one, divorce, that's 50% of the population is going to go through that, moving, important to remember when your friends are moving, major illness or injury, or job loss.
Oh my God. And if you're getting divorced, you're likely moving as well. So holy shit.
It's a lot. And one last point about this. Sometimes we go to a therapist not because we can't handle the terrible life event on our own. Sometimes you go to a therapist so that you don't distract yourself from processing the event, so that there's a scheduled time each week to face the thing that you might otherwise want to avoid. I mean, none of us want to look at darkness. None of us really want to sit and mull our problems. You know what I mean? So going into therapy when you're having one of these major life events, if that's just your automatic reflex, what it does is it ensures that you're addressing your wound on your schedule and on your timeline so that You're not years in the future having a fight with a friend and suddenly you find yourself in the fetal position because the pain that provokes is really related to the pain of a major life event that you told yourself you were handling when in reality you just kept on moving. And that can be debilitating. Because if you ponder, do I need therapy? Do I not need therapy? What about, do I deserve therapy? Like once a year we get a physical, I hope. Everybody should be getting a physical exam once a year. My clients get them once a year because I want to always make sure I'm not treating something that's a medical condition psychologically. I mean, that would be terrible to put somebody through. Like asking them to make psychological changes and behavioral changes that are the root of which is medical. Can you imagine?
No.
Diabetes, for example. The person is like fainting, having like low blood sugar attacks. And I'm like, we need to increase your window of tolerance. You obviously aren't tough enough. And it turns out that the root of the problem is a pancreas. So we always want to be getting somebody physical exams annually. And we also, it's always best to just touch base with a therapist for a couple of months when you have a major life event, just to make sure you check that box and that you're not just muscling through it. Most people can muscle through major life events, major transitions. Just because you can doesn't mean you should.
Yeah. And I do agree with you. I will say though, I think that it is very possible because I've done it to get through traumatic life events not by yourself, but without therapy. However, I don't think I would have been able to do it ever in the first place if I hadn't been in therapy at least once. Because ultimately, isn't therapy supposed to help give us the tools and teach us how to move forward in a better way and emotional regulation and all of that? Should I have gone back to therapy after the horrible breakup? Probably, but I'm also extremely blessed that, you and Steph love me. And while you can't give me therapy, you certainly know how to help.
And so you need to remember that, and listeners need to remember that. You're not normal, Ashton. You have a support network that other people do not have access to. You are related to 2 therapists. So that's not normal, and you're very close to both of us. So you lean on us in ways that other people might not lean on an aunt. You have access to resources that other people don't have access to. So yes, can some people get through major life events? Lots of people can. Again, just because you can doesn't mean you should.
Yeah. So what if you're not going through a traumatic life event or a life transition and you're not even struggling particularly horribly, but you know that you want to get better and be better, just be a better version of yourself emotionally? Is that ever something that would merit going back into therapy, starting therapy?
That is my ideal client. That is the person that I thrive the most with. That is a client I want to work with.
Would you describe that type of client? Like a growth-oriented client?
Yes,
or someone like
person is killing it in their career and they realize that their friendships are a little superficial. They don't have a significant other, or the relationship that they're in is not as deep and as intimate as they wish it were, or it's just not as fulfilling as it could be, or maybe they know it's not right for them, or they've been single for a long time, killing it in their careers. And these are the people that I generally work with. On paper, everything is not just good, it's outstanding. But they want more. They want their personal life to mirror their professional life. They want the same level of fulfillment personally that they have professionally. We don't teach people the importance of building your tribe in your 20s and 30s, because what happens, those are the 2 decades where we collect the most amount of friends. And lots of people who then go off and start their own families, whatever that looks like, family systems, they lose touch with each other. And what happens is in the decades that follow, the 50s and 60s, people are really lonely, really lonely. So what we should be telling people is in your 20s and 30s, you need to be building your tribe, just like you're hopefully contributing to your 401k or whatever equivalent of it there is, because what those early years exposes you to, that's time that you can't make up, both financially and in terms of collecting friends. It becomes much more difficult to collect friendships and relationships after we get in the grind of life, after we're full on into adulthood.
It's possible though, it's very possible, but you're just saying like it's advised to build that foundation.
Absolutely, because you're not going to have the exposure to the number of people that you have an exposure to. There aren't going to be as many people in your age cohort as you age because people die. Literally.
Yeah.
I mean, so just from a numbers perspective, you've got way more people your age now than you will have in 20 years.
That doesn't bother me, I'm going to be honest.
And that doesn't even have anything to do with what you do with your life or where you live. That's just the general bell curve. It's a numbers reality. So people who want to thrive, who want more, yeah, you have to find a very specialized therapist who works with people who are essentially in the gifted and talented program of therapy. I like to think of my clients as like the AP students of therapy. On paper, there is zero wrong. And in reality, there's often zero wrong. They want more. You can live in a 1,000-square-foot home your whole life and be very content and healthy and safe. And some people want more, and that's okay also. And some people don't, and that's okay. But for sure, if you're somebody who just craves growth and learning and doesn't think that so if I were going to learn a foreign language, I could never do it on my own. I would never be able to work with like a home study situation or an app or like learn it on my own, even though there's more than enough information out there that I should be able to learn a foreign language on my own. I would need a scheduled appointment every week with someone because I need that accountability. And if you're somebody who wants to learn about themselves and about mental health or about being better emotionally, being able to manage your emotions more effectively, have more flourishing relationships, then you want to look for a therapist who specializes in that particular type of client. Most therapists work with clients and are more comfortable with clients who are on the end of the spectrum where there's symptoms. And I'm not trying to say that clients who come to me don't generally have symptoms. They absolutely do. Usually have some symptoms in the beginning. My goal is to neutralize those as quickly as possible so that we can do the stuff that I really am passionate about, which is like, what do you want your life to look like? Let's dream about that. Let's figure out how to tweak that. What do we need to do to make your life look the way you've always wanted it to look? Because you will blink and a decade will be gone.
All right. Well, I'll have to journal after this. I want to pivot here because everything you're saying sounds, sounds right to me. It feels right. But I do want to pivot to medication. What are your thoughts on people who take medicine, who aren't in therapy? And, medication, I think as a whole, I'm just curious because it's powerful. It can be very powerful.
I mean, you're talking to someone who is on a long-acting stimulant, as we
say. I mean, we're same here.
So I'm a believer in medication. How do I feel about people who take medication and aren't in therapy? I don't like it. I'm a believer of medication. And for most of our listeners, psychotropics are mostly masking our symptoms, which is okay if you're in therapy and masking the symptoms is the thing that lowers them, alleviates them enough so that you can actually do the work that will cause the longer term healing. But with the exception of like a serious mental illness, and by that I mean a debilitating level of anxiety, depression that shows no improvement after a good amount of therapy, other than that, serious mental illness usually refers to mood disorders like bipolar disorder or a thought disorder that involves hallucinations or delusions. That's not the majority of our listeners. The majority of our listeners are neurotic New Yorkers wherever you live, wherever they live. They're people who are thirsty for personal growth and self-improvement, and they're not struggling with thoughts that other people can't hear or visions that other people don't see, which would fall under the category of hallucinations and delusions. With the exception of serious mental illness, we should not just be taking medications without being in a type of therapy that is known to be effective with whatever you're diagnosed with, because it's just masking the symptoms. And there will come a point in your life, most likely, especially if you're a woman, where you're going to want to come off the meds. You're going to want to get pregnant, or you're not going to like the side effects, or you're going to become very health conscious. You're going to want to titrate off of the meds. And if you haven't done the deeper work to heal the root of the problem, then all you've done by taking the medicine is what I did by taking the ibuprofen for my headache before I came here, which is
When you say,
I just masked it.
but when you say root of the problem, but what if the problem is simply just a chemical imbalance in your brain? Like, you can't actually fix that organically, can you?
There are very few people in life who legitimately have a chemical imbalance. Very few people in life for whom therapy would not be incredibly beneficial in tandem with the medication. And most people don't want to be on medication for the rest of their lives. They don't want to commit to it for life. When you go on a psychotropic, it is rare that you're on and off it, even within 6 months. For most people, it's at least a couple years.
Right.
At least a couple years. And for many people, it's an on-ramp that there's no off-ramp for. And I don't want to cloud the waters by implying that I'm at all anti-med. I mean, I've been on meds since I'm 26 years old, half my life, almost. So I understand the importance of medication. What I'm saying is, if you have a chemical imbalance,
That is what I was told when I first went into therapy, not from a therapist, but just from people who thought that I needed therapy. It's a chemical imbalance. And I was like, well, it's something.
short of a serious mental illness, and I listed them already: bipolar disorder, debilitating anxiety, debilitating depression, or a thought disorder that is usually some level of schizophrenia related, and that's not most of our listeners. Short of those, I vehemently disagree with that.
Speaking of therapy, there are different types of therapy. Which, as a therapist, are your favorite types of therapy?
Let's start with my least favorite type of therapy. If you've been following me for any period of time, you know I am not a fan of talk therapy. I think it takes entirely too long. I think that the goals are often very unclear or never established at all, and I find it to be very impractical. I basically think it is a breeding ground for apathetic, passive, disengaged therapists who provide minimal results.
Well,
They're gonna
tell us
come
how
for me.
you really feel.
They're going to come for me. They're going to come for me, and I'm here for it. I am a fan of two major types of therapy, both of which are evidence-based. EMDR therapy, which is a type of therapy that was developed to treat trauma, but it is used on a wide range of issues beyond traumatic events. It's something that I use on most of my clients. And we have an entire episode on EMDR called How to Cure PTSD with Laurel Parnell. But here's a brief overview on how EMDR works. So when a bad thing happens, it can get stuck in your brain and cause very intense feelings and thoughts and body sensations. Talking about that memory in talk therapy can activate those memory networks. It will activate those memory networks again, and that can leave you feeling no better than you were when the bad thing first happened. And by that, I mean, you talk about the thing and you're as lit up, you're as activated, you're as jacked up as you were when the terrible thing first happened. And that's how you leave therapy. There's no relief. And that can be re-traumatizing. EMDR therapy allows you to process those memories in a very short amount of time so that it no longer has to hold have such a strong hold on you. You can think about or talk about the bad event with a level of objectivity that's similar to the way a journalist would report the news. And with many people, EMDR can do the work of years or decades of therapy in a fraction of the amount of time. So
Wow.
I'm a real big fan of EMDR therapy. And even if you work with a certified EMDR therapist and only do talk therapy, that therapist is trained to know when they're lighting up your neural networks around a very traumatic or terrible event that happened in your life. And they're trained to see what the signs are that this is not something appropriate for talk therapy and you need to use the EMDR. So talk therapy is it's a baseline of a therapeutic intervention. It's like ballet is to dance. Everybody learns it and then goes off and specializes in their own thing, but you've got the technique under your belt. I like somebody to have a trauma-trained therapist, particularly in EMDR, so that when you accidentally stumble upon a traumatic memory, the therapist has a tool and knows how to use that tool to help you reprocess it without further harming you.
Mhm.
The other type of therapy that I like is called DBT, dialectical behavioral therapy. So DBT is a type of therapy that teaches people how to manage their emotions so that their lives are more peaceful, they're less chaotic, and they're far less dramatic. It was originally designed or developed for people with intense emotional swings, self-destructive behaviors like those with borderline personality disorder, but it is also very effective for issues like depression and anxiety and eating disorders. It's basically a combination of cognitive behavioral therapy and mindfulness practices, and it teaches you skills to cope with stress and regulate your emotions. And what I mean by that is it teaches you how to tolerate distress. That's called distress tolerance. We all need to know how to tolerate distress. Not all distress is toxic. It's not all bad for us. Life hurts a little. And we have to not be little snowflakes who can't handle honesty and the
Oh.
realities of life. Like life pinches, life is rough, and we have to be able to tolerate that. It also teaches emotional management skills and relationship skills, like how to communicate more directly so that people aren't in situations where they're questioning, what did she mean by that? Did she mean this? Did she mean that? And then people don't meet your needs. It teaches you how to be more direct with your needs. So how do you know which is right for you? I would say if you know you have a history of trauma, if talk therapy has not worked for you, if you know you have recurring triggers or limiting beliefs that trip you up in various areas of your life, or which have tripped you up with multiple people in your life, start with EMDR therapy. So if you know that you've got some common denominators that normal therapy has not been able to help you with, and you've had the same issues across relationships, I think that that's a great opportunity to do EMDR. If you have difficulty managing your emotions, if you have a history of being impulsive, if you've lost multiple jobs because, well, not because you suck at your work, but because either your bosses disagree with you or you disagree with your bosses, you don't get along with people. And if in general you have difficulty in your relationships, then DBT therapy is a great place to start. I actually think we should be teaching DBT in high school. And for the record, I have never met a person I didn't think needed DBT, including me. Like it is a world of skills that are, I mean, we teach people algebra and geometry. I mean, other than needing geometry for our eyebrows, Ashton, and contour, what the fuck do we need it for?
For me.
So what do we actually need it for? Whereas if we were teaching DBT, you would use it every day in your life, in every area of your life. You would do better at work. You would do better in your family. You would do better in all your relationships.
You would be better.
Regardless of the type of therapy that you choose to engage in, I think that your therapist should be able to tell you a few things at the top of therapy. Which of your issues they think they can help you with, how they're going to help you, like what is the strategy that they're going to employ, how they're going to measure success, like are they going to use a measurement tool? If so, which one? And are they going to measure your baseline before you start therapy so that they have a point of comparison? And the date by when they're going to evaluate the success. Now, if you ask your therapist those questions and they can't answer them, or worse, they turn those questions on you with some traditional psychobabble retort like, well, why do you think it's important that you know all these answers before committing? Like the problem is in the question that you're asking and not in their deflection of the answer. Run for the fucking hills. At the bare minimum, a therapist should be able to explain to you which problem they're going to help you with, how they're going to do it, and how they're going to know that they're effective. It's the most basic part of being a service provider. And they'll come for me on this because a lot of therapists can't do it.
Well, I was just about to say, I just came to the realization that quite literally none of my therapists in my mental health career, which is quite expansive, have done any of that. Of course, it's a job. You have to take time for your mental health or it takes time from you. So I want to talk about, lastly, something that has been popping up, I would say in the past, 7 years. It's more recent. But what do you think of therapy apps?
So I want to preface this answer by reminding people of what is involved in becoming a therapist. So for my profession, and I'm a licensed clinical social worker, you've got to get a master's degree. I did a little math on this. The average cost of a master's degree in social work is $101,000 a year. I'm sorry, combined. It's a 2-year degree and it's $101,000. That is averaging public schools with private schools. By way of comparison, I asked Steph, who graduated NYU in 2006, to go back to her original student loan debt. In 2006, which was almost 20 years ago, she was 96 in debt. So when I say it's 101,000, that is a very conservative number. So conservatively, you come out of school $101,000 in debt, and then it takes you another 3 years before you're licensed to practice. All the while, you're making monthly student loan payments of $1,100 at a 6% interest rate. That is before rent, food, or any living expenses. The average cost of a therapy session with an LCSW is $200. On the average, BetterHelp pays licensed clinical social workers $46.42 an hour. You tell me, Ashton, what kind of therapist takes less than 25% of the profession's average fee?
I mean,
I am not a fan of therapy apps. I am not a fan of it.
People might be better off just asking ChatGPT for mental health advice than that, or listening to this podcast. But I mean, I do want to just not argue, but contrast and say that I do think that people being interested in a mental health app and a therapy app could maybe segue them into looking for legitimate real therapy. I do think that there is something to be said for making it a tiny bit easier or accessible for people to do something with their mental health, and then maybe realizing they have a much larger goal or they want more.
The problem with that is that the likelihood that somebody is going to emerge from that experience with a negative therapeutic experience is enormous. And then that goes back to the first question you asked. Why would somebody be hesitant to seek therapy? Well, because they had a bad experience and it didn't work for them the first time. My biggest concern would be that you'd walk away with a negative therapeutic experience, and that would be a hurdle to getting your next experience in therapy, because rarely do we hit, it's like dating. Finding the right therapist is a little like dating, and rarely is the first one the last one.
Right. Or even the second one. Speaking from experience on both fronts. On that note, I will read us out. We Need to Talk with Dr. Darcy Sterling as a Sterling Standard production. Editing and sound engineering by Bart Migal. Our theme music is by Trending Music. Special thanks to Amanda Cristiani, Preston Smith, and Stephanie Sterling. If you have a friend who you think needs therapy, feel free to text this episode with them. Maybe with an emoji to soften if needed. We'll be back on Tuesday with another episode packed with relationship, dating, and mental health hacks you've come to expect.
Thank you, Ashton.
Thank you.